Good evening, and welcome to this program here on our media partner, blackdoctor.org. I am Ellis Dean. I will be your host for the evening, and we have partnered with Uzima Health and Wellness. You may have heard that before in the past. We partnered with them for a wonderful program. Now, September is not just a song by Earth, Wind, and Fire. We all know and love that song, and I know Taylor Swift loved it so much that she redid it. But that's for another conversation. But September is also Sickle Cell Awareness Month. And as many of you know or don't know, sickle cell is a illness. Sickle cell disease is an illness that predominantly impacts communities of color, Black individuals, people from the African diaspora. And there are a lot of layers to that. There's a lot of social determinants of health that comes into play. There is a lot of, we'll call it prejudice and discrimination against that particular group of individuals that comes into play. And so we're here tonight to discuss all of those interlays. We've got some advocates, we've got people that had lived experience in caring for a loved one, and we're going to have some specialists, some hematology oncologists, say that 5 times real fast, to come on and give us some of the background and how we can help. Because even if we don't live with sickle cell disease, we can help advocate for that community. And so we're going to give you some steps on how to do that. But there's a couple of things I need for you to do before we get started and bring on my co-host for the evening. Number one, I'd like for you to let us know where you're watching from. So if you city, state, country, wherever you're watching us from, drop that in the comments section and we'll give you a shout out. Number two, if you know somebody that needs this information, tag them, share this on your page, because we want to get this out to as many people as possible so they can learn all of the great information that we're about to bring to you tonight. And then number three, if you have a question that comes up throughout the program, you need some clarification on a particular topic we're discussing, drop your question in the chat room and we'll get to that throughout the program, because we want to make sure this show is all about you and it's about get your questions asked and answered. So I know you didn't sign on just to see my face. I'm going to bring on my co-host for the evening, and that is Dr. Kendra Outler from Using My Health and Wellness. Dr. Outler, how are you doing?
I'm all right. How are you, Dean? I mean, it's been a minute, but I always love working with you. I always can count on you to champion a cause when I'm saying, you know what, we have to talk about this. We have to talk about this. I'm going to add a fourth, and that is if people have not signed up for my newsletter on myuzima.org, please sign up. We are discussing these issues. We're going to continue to go through the health disparities calendar. There is a lot of information now that's disappearing from the websites, like the CDC and the NIH, and I hope to be a resource. And that is exactly why I did this show. I'm not going to delay long. I want to get into the first person that is a fierce advocate of healthcare in the Chicago area. It is my pleasure, my honor to know Commissioner Donna Miller. She's a 1987 graduate of Howard University. So yes, she is a fierce warrior for healthcare in the Chicagoland and nationwide. She's led so many different initiatives here. That'll be another show. But most importantly, she's worked with CPR and AED training within the Chicagoland. She has worked with the maternal health crisis here in Chicago, reshaping that landscape for Black women and all women in the Cook County area. She has formulated a plan that can be transported to other areas in the nation. And so this is not just a one and done for her. She has a long list. And so as we were talking about my health disparity challenges and issues, she just said, sickle cell, that is my family, my people. And I was like, what? So you know what? Here we are. And without further ado, I want to introduce my friend, our healthcare warrior that we're so lucky to have in Chicago, Commissioner Donna Miller.
Thank you so much, Dr. Outler and Ellis. It's great to be here, especially during Sickle Cell Awareness Month. So thank you for being a voice for people to tune in and learn evidence-based medicine, factual evidence, and factual information about disease states that affect all communities. But in this case, sickle cell really affects the African American community very directly. And I do know about that firsthand.
What I want you to do, Commissioner Miller, because I know your time is definitely valuable and limited, but I brought you on first for a reason. I'd love for you to share, when you said those are my family, what do you know about sickle cell? And what is your lived experience with this disease that affects over 100,000 primarily African American people? It is a genetic disease. It's nothing that we went out and grabbed off a tree. It's nothing that we digested. This is an evolution genetic phenomenon that protected us from malaria from Africa. And due to the diaspora, we know that 3% of Hispanic people also share this disease. So please tell me your shared experience. I want to give you the floor to talk about it.
Well, thank you. Yeah, so in my family, my sister has sickle cell disease. And as Dr. Outler stated, you're born with it. And so this has been a condition that my family has dealt with her entire life. So my sister is 43 years old. Mm-hmm. And being a child with sickle cell puts a strain on the entire family. My mother spent countless hours in the hospital because my sister was having pain crisis as a child and needed blood transfusions on a continuous basis. And now as an adult, actually, my sister just got out of the hospital today after being in the hospital for 10 days this time. And it gets worse as time goes on, the number of blood transfusions that are needed and the intense pain that accompanies it. So a couple things that happen during sickle cell that, aside from just going to the hospital and trying to get relief from the pain crisis, but there are severe and stigmas that are attached to patients with sickle cell crisis because they're in pain. And at the time, when you think of, like I said, my sister is 43. So in the late 80s and early 90s, people were thinking, oh, this must be some drug-seeking behavior. And luckily, I had the type of mother that I had, because my mother challenged the University of Chicago hospital every time she came to bring her sick little child who needed care, compassion, and someone to advocate for her, not stares and sneers and questions that were looked at like, oh, you must be here for drugs. My mother said, you know what? If I wanted drugs, I certainly wouldn't come to the University of Chicago for drugs for my child. I would go where people go for drugs, in the street. Mm-hmm. I'm here to get health care. And actually, because of that, my mother and my sister brought together advocates within the hospitals, nursing staff, doctor staff, and they were able to create a patient bill of rights for patients, and especially patients who have a genetic disease. That's how it started. But then so that patients were looked at as someone who knows what's going on with them, the people who are there advocating them, like the parents, know what's also going on, and they should be treated as such. Mm-hmm. So I'm not sure if that patient bill of rights still exists, but at that time it was groundbreaking. Mm-hmm. And it was something to empower patients so that they could advocate for themselves without any sort of stigma attached to it, and especially a child. So when you're a mother, the first thing and only thing you care about is your child's well-being. And to have that be ignored because they thought, oh, you might be a drug-seeking patient, they talked to the wrong mother in that instance.
Well, how does it feel to I guess you say it does affect the family. What about being a sibling? Because you're the older sibling and you have this sister that kind of gets all the attention. How did you, can you speak to being a sibling? I know we talk about sibling grief, not being able to either have a sibling that can run and play with you. Maybe your sibling has a disability or a chronic illness. How did that affect you? And is that what that made you energized around healthcare issues? Because you're such a fierce warrior about healthcare issues, and also with your mom. Kudos to your mom.
Right. Well, I'll give all the credit to my mother for teaching us that. But since you outed me in the beginning, I'm significantly older than my sister. So, but because of that, I was looking at things related to her disease state more. I wasn't an adult all the way yet, but more from an adult standpoint of how to manage things and how to help get resources in for my sister at that time. And there really wasn't much you could do. I mean, there really wasn't much you could do when she's in the hospital. She's not able to run and jump and play. I didn't realize until much later that my sister never learned how to ride a bike because she didn't have the stamina to do that. She doesn't know how to, I don't think she really knows how to really ride a bike now. And now it's kind of a little joke, like, yeah, girl, you can't even ride a bike. But now it's because she was always in the hospital. The other thing is my sister is very tall. So she's 6'1".
Oh, wow.
And when she was about 5 or 6, they told my mother, you know, she's going to have stunted growth because of sickle cell and because of all the, you know, treatments that she's had. So my mother said, well, now that she's 6'1", she said, I guess that stunted growth either didn't work or she was going to be a lot taller than she was supposed to be. So we can find things to bring us laughter and joy. I mean, even within that. And her being 6'1", she has like 47-inch legs. I mean, she's all legs.
Oh,
so
wow.
that's also, you know, an interesting fact for someone of her height. So, but we didn't have any kind of sibling rivalry because we're in different age. What we really were focused on was how can we help our mother help her? And as time has gone on, I've been more of an advocate for that just because I did end up being in the healthcare industry. I ended up actually working on genetic diseases on the other side of things in my professional career. I worked on cystic fibrosis. And I was trying to learn, like, how can a disease like cystic fibrosis have so many resources when a disease like sickle cell doesn't?
Right.
And that comes from those who advocate for it. So I use that as a story to say that those who advocate for things, those who put their money where their mouth is, that's how some things get done. That's how in the cystic fibrosis community, they were able to find gene therapy earlier rather than later. They were able to get resources and hospital centers specifically focused on CF because they advocated for that. I know we have sickle cell hospitals and sickle cell physicians, that, you know, physicians focus on sickle cell, but it's not nearly to the same degree. And especially for a disease that has 3 times as many patients. Sickle cell is about 100,000, as you mentioned. In CF, it's about 30,000. So they have significantly more resources. So we, as an African-American community, really should come together to put our resources there. But many of us don't even know. It wasn't until maybe about 20 years ago that sickle cell was even part of the newborn screening panel in all states, so that you would know ahead of time, or try as close to ahead of time, you know, early in the disease state if you're born with it, that you know that is what your disease state is. So we have a lot of roads to cover as far as that goes. But the biggest thing is for patients my sister's age, they're in a kind of conundrum. They're in like a lull state because the advances that happened in sickle cell happened at a time that she's now ineligible for many of those treatments.
Right. So she was, for when the stem cell treatment and protocols were fully developed, she was actually transitioning to adulthood. And so were not offered to her. Let me ask you this. Does your mother, did she discuss anything about her preconceptual counseling? You work for Planned Parenthood. You were also the chair of the board for Planned Parenthood. So you know these type of services in our communities help us with counseling, for preconceptual counseling, pre-pregnancy counseling, which is so important. So did she ever discuss that, or have you known of centers that are now really saying, listen, we still need to talk to young women about it if they have the trait and they meet someone? You know, we're an international society. You might meet someone and you have the trait and he's from the Caribbean or Africa, and, you know, lo and behold, you have a child with sickle cell. So it's still, children are still born with it. But tell me what her experience was and what you know about preconceptual counseling for sickle cell.
Well, since I have sickle cell trait, and I've known that my whole life, because I guess my father was in the military. They did excellent care in the military. So I've known my whole life. My mother would always say, now just don't marry anybody with sickle cell trait, because then you could have, you know. So I always knew that. I always knew that. However, so when my mother had my sister, it was kind of, it was her second marriage. She thought she could not conceive anymore. And that's kind of how it happened. Even when my mother was 5 months pregnant, it was till by her 5th month of being pregnant, they were like, "You're not even pregnant. What are you saying?" She's like, "Listen, I know what being pregnant is." And they kept telling her, "No, you're having a hysterical pregnancy, all this." So it was the 6th month that they actually told her, "Oh, well, you are pregnant." And then now she's just 6 months in and didn't think that the baby would have sickle cell disease, but that was the last thing really probably on her mind at that time.
Wow. I want to bring on our next guest, Tyree, and thank you so much, Commissioner Miller, for sharing that, my Donna. Because this next guest is a mom, Tyreen Gibson, who actually has written a darling book called Loving the Crescent Moon. And I love the title of the book, and I love her story. And she's a mom who had a daughter that she reflects on in this memoir, if you will, about their struggles and about her realization and her fight to save her daughter. So I would really like to, without further ado, bring on Tyreen Gibson, our other advocate, because you all have some overlap in your story. Yay!
Yay! So Thank you. Thank you for having me during Sickle Cell Awareness Month. I really appreciate this.
Hold the cover up again, Tyreen. It's such a beautiful
This is my book, Mothering the Crescent Moons. This is based on my journey as a mother and caregiver to my daughter, Aya, who was born with sickle cell anemia, that went through a bone marrow transplant and is now cured of sickle cell anemia. And this was a book that I wrote to help families that are going through that have sickle cell anemia that may want to go through a bone marrow transplant. But it also is addressing anyone that has any type of cancer, leukemia, or blood disorder, and having a parent that is an advocate and a caregiver. So that was the reason that I wanted to write the book, to give back to families that are going through similar situations that I went through with my daughter.
Tyreen, how old is your daughter now?
She is 24.
And at the time we met, she was a college student at Loyola University.
Yes, an undergraduate, yes.
Give us an update, and then I want you to take us back to some of those dark days in the hospital and your transition to the treatment. I think that's so powerful.
Okay. Aya went to Loyola University in New Orleans, and she graduated in biology. And then from there, she went on to Rutgers University in New Jersey and graduated with a master's in biomedical science. And now she is attending Hackensack Meridian School of Medicine in New Jersey. And she just started her medical school this July 7th.
Outstanding. I'm so proud of her. I know you are. My heart is just...
I'm so proud. I'm so proud. Because it was a long journey.
Yes.
And we're still going through it.
Yeah. So tell us, I wrote down my notes because I love the book so much. I was an advocate. She held you up at some times. And when she said to you in the hospital, I want a cure. Can you take us back to, like Donna was saying, Commissioner Miller was saying, my sister's been in and out of the hospital. You were on the same trajectory.
Correct. I mean, I knew when I was pregnant that I was going to have a child with sickle cell anemia because I had an amnio done. So when I was pregnant, I started to prepare myself for that journey. But it wasn't until Aya was the age of 3 that she had her first pain crisis. And then from there, we were in and out of the hospital up until the time that she went through her transplant when she was 11 and a half.
Mm-hmm, mm-hmm. But you said something that she overheard. She overheard
a doctor, the doctor that was part of the bone marrow transplant team, talking to another family. And they were talking about a clinical trial that they were doing for sickle cell patients. And she just basically went up to the doctor and said, we would like to meet with you because I would like to be cured, and we want to be able to be a part of this clinical trial.
Now,
so there's a couple of things we want to kind of recap. And I know we're deep in the conversation.
Right.
We want to make sure
it's like
that
it was the tea.
I want to make sure our audience is staying with us. So number one, Dr. Aller, help our audience understand, because Tyreen, you said you had an amnio. We need to help our audience understand what an amnio is, so people can recognize how she was able to identify before her child was born.
This is the preconceptual and conceptual planning that we talk about. I'm sure this is something that at a certain age, where's Commissioner Miller? Because she also would understand this as well. That a certain age,
I was 34, so when you're 34, you have to basically have an amnio, just to make sure that you have no conditions that would be detrimental to the baby.
They check for a panel of disorders. So like trisomy 21, also known as Down syndrome. They check for a number of kind of disorders in that amniocentesis, where they put a little bit of the amniotic fluid.
Correct.
And take it. So this is why this is so important. So I think what Commissioner Miller was saying, in terms of what her mother was able to have having a child at her age, and then Ms. Gibson's saying basically, it's technology and information and testing, and that even if whether it's preconceptual or during the pregnancy, this recommendation of being what we call advanced maternal age and what you should expect and what tests. And women, you could have refused that, right? It's not. It's
I could have refused it, but my doctor recommended it, and I said, I'm going to go ahead and have the screening.
And so, go ahead.
I was just going to say, in my mother's case, because there's a big age difference between Tyree and my sister, but my mother was 40 at that time also.
Oh yeah, and they didn't do a screening with her.
Well, because they were saying she wasn't even pregnant, so it wasn't even at that time.
How did they not know that she was pregnant? They didn't do a blood test. They didn't do a urine test.
That's another show. But when
I'm like, they knew right away.
So I want to also talk to you about when you all made the decision to have her tested, and goes back to something Commissioner Miller was saying. You set yourself on a pathway of
educating
yourself. But this journey also was fraught with more hospitalizations and more, let's say, illnesses. The hope for treatment came with kind of the struggle.
Exactly.
So I think that whether you're cured or didn't get cured, your families are going to have to deal with hospitals, and you're going to have to deal with struggles and setbacks. And I think that this is something that I think about when I hear 350,000 Black women are leaving. They say leaving, like we're voluntarily leaving, are losing their jobs. Okay. And some of these moms or some of these women may be trying to have children, may have children, or may have their own healthcare challenges. And this is something, since it affects Black women, and they keep saying 350,000 Black women. So they're being very clear about the demographic who's going to be out of work.
I mean, I changed my whole career path after that, after I found out that I was having a child with sickle cell.
Oh, tell us about that.
I was working in television in Manhattan, and I changed and went into real estate because I needed a job that was a lot more flexible. So I was a real estate agent and also a title producer. So I worked basically 2 jobs. I worked for a title company and I sold real estate in order to try to change so that I could be more at home and I could work and create my own schedule, because the 9-to-5 job wouldn't have allowed me to do that.
So
I do have a question. Are there any things that parents or people living with sickle cell disease can do in order to widen that gap between pain crisis events, right? So we know that's kind of part of the experience of living with sickle cell disease, but is it about exercise? Is there some diet? Is there anything that they can do to widen that gap between, so maybe going from 6 months to, you know, 3 years
I mean, I
between
think
the
it's
age?
important for parents to make sure that the patient drinks a lot of water, that has the proper diet, that gets enough sleep. Um, I know we would always keep Aya out of extreme weather situations.
Mhm.
So when it was really cold, she couldn't do certain things like some other kids would be able to go out and play in the snow for long periods of time. We would keep her in. The same thing with going in during the summer months with getting into a swimming pool. If that water was extremely cold, that
Mhm.
was something that we would not allow her to get in that pool because that could trigger
The pain.
sickle cell pain crisis.
Mhm.
So there were several things that we would try to limit or change about how we would, deal with her in certain situations. I
Mhm.
didn't really allow her to stay over at other people's homes because,
Mm,
Mhm.
if she had a crisis, would they know what to do and how to handle the situation? And temperatures in the house, I had to make sure that the air condition in the summer was working correctly and that it was on in the winter to make sure there was enough heat in the house.
Mhm. I think that's a very good question, Ellis, because families end up knowing and the child ends up knowing what they need, even down to the type of narcotic that helps them, which
right.
is why they get labeled in the emergency room and on the floor when they start to quote unquote demand certain things. They're not demanding. Sickle cell patients, the pain is the disease, and that's what people have to understand. That is the disease, and when that flares up and they need certain, they know even from infants they get, if you're not at St. Jude or a major or Lurie's Children's Hospital, major centers that take care of in Philadelphia, they know what, they know how to take care of our sickle cell children and babies and children. So nobody gets all excited. But if you're not in a major center where
Right.
they
Yeah.
take care of sickle cell families and children, they freak out. And so this becomes an issue all through adulthood. This is why this becomes, there's race in the sense that Black people get sickle cell 90% of the time. This is in our population. But the racism happens and how
Hmm.
it's treated through the system. And so this is a convoluted story of race and racism when it comes to this particular disease. And then when it gets to the politics, what we know is that when we had this attack on drugs and limiting narcotic use, the sickle cell patient was like, "What about me?" What they were now in this catch where there was no slip that says everybody can get the number of narcotics that they need, and make sure that sickle cell patients get what they need, right? There was no bypass for them, and so they fell into this book where they were mistreated, and more increasingly so, particularly in the 90s when there was this fear of giving them, they were drug seeking, and this is we have limited medical students that are exposed to sickle cell patients and
Hmm.
families, that this unfortunately continues to be perpetuated no matter, as they move about their lives, even today, even though we have more education. So I know Commissioner Miller's time is limited. I want you to tell us in the Chicago, where are some good resources that you found that help your sister? And I do thank you for joining us.
Well, thanks again. So one thing I do want to make mention of is in my position as county commissioner, I always do a resolution every year for Sickle Cell Awareness Month. And I look at that as a way to leverage the community, all communities, to uplift the conversation about what is sickle cell, not only that African Americans know about sickle cell disease, and how it
Everyone should
impacts
know. Everyone should know. Yes.
know, and everyone should know families like yours and how this impacts families, how it impacts hospital systems, how it
Hmm.
impacts emergency rooms, how it impacts nursing
Hmm.
care. And the need for, I'm glad your daughter is going to join the medical field. That is fantastic. We
Thank
need
you.
her. And then
Yes, we need her.
beacon and a light for others in her medical class and beyond to say, I understand what healthcare literacy looks like. I understand how we should have compassionate care for patients because it happened to me.
Yeah.
She's going to be a
And that's why I'm always in everyone's face. Everyone, all colors, all nationalities. I want them to know about sickle cell and what patients, what happens to patients with sickle cell. I want everyone to know. So I talk to everyone about it. And I really put it in their face. But I do advocate for patients that are going in the ER. I think that we should have a protocol that is set up in every hospital, ER, or sickle cell center throughout the country. I know that the hospital that we went to often, they had sort of a protocol, but most ER hospitals and sickle cell centers do not have a protocol when patients come in for treatment. And that is something that I would like to push forward and to advocate for, along with all the Congress people and like yourself. And I work with the National Donor.
I'll call you.
Yes.
I'll make the connection. I'll make the connection.
Yes.
You know I'm good for Commissioner Miller.
But that is something that I would like to continue to push forward for, and also campaigns, having more campaigns, especially in the Black communities, but all communities. I think that just like they have campaigns for breast cancer, they need to have campaigns for sickle cell awareness and genetic counseling as well. I think that all the students just in HBCU schools and all universities should know what their genes are. And also when they're pairing with other partners, that they should have these conversations so that you're aware of it. I mean, we didn't have these conversations when I was growing up, but I think students now should.
Thank you.
Good. And so that's why I'm going to La Rabida Hospital. I think it's tomorrow. And we're presenting the resolution in the county, the Cook County resolution at La Rabida, where my sister spent half of her life, literally, at La Rabida. One thing I just wanted to add to is, when you're in the children's hospital, as my sister was up until, the age that she couldn't be there anymore, but she got extended because of sickle cell.
That's right.
There was no one else to take care of her. But one thing that was such a revelation to me and the rest of our family is my sister told me when she was about 18 that she's never seen an adult with sickle cell. She never thought she was going to be an adult.
That's that's another to be on the other side, like where Tyrene's daughter is and where your sister is now.
Yeah, I talk to a lot of adults that still have sickle cell, and I communicate with them quite often to get their perspective as well.
That's through advocacy, and we have to continue for advocacy, continue for research, so we know it works.
Absolutely. Yes.
Thank you so much. And Dean Ellis, can we go to questions?
Well, I think one of the things that we need to discuss as we're moving this conversation forward is those things that parents can do and people living with sickle cell, particularly in that space where you're transitioning from pediatric care to adult care, because a lot of times that's where the drop off happens in a significant way, and a lot more deaths can happen in that transition from pediatric care to adult care. So one of the things that any parent can do or an advocate can do is, and when we're raising funds, raise funds for them to have that medical binder that they can take with them every time they go to present to an emergency room. Because we know emergency rooms are always turning over with regards to staffing, nursing, personnel that's available, and not all of them are as abreast or as keen to it, to sickle cell as others. And so if you have that binder and you have your pediatrician or your doctor, your hematologist, whomever you're working with, a number to where they can have that doctor-to-doctor conversation, That'll help speed that process up instead of you having to become frustrated trying to convince them that they need significant care and they need significant medication that's different than somebody that's just drug seeking. And so we've got to get over that hump, and having a accurate ongoing medical record, and you keep every time they go into the emergency room, you put that discharge slip in that binder so they can see how many times you've been. Is it necessary? Yes. Should it be? No. But we're talking about what you need to do to help your loved one, your child, your family member, versus what the medical establishment should be doing. That's a whole different conversation.
Well, I'm going to say this about medical records, and this is where we do have. I think the binder is outstanding, but we have the electronic medical record. I was a medical records clerk at Grady Hospital when we had the almighty binder stack. But what I will say is, if you're, fortunate for your daughter, she had a mom that knew how to, had to be organized, that knew how to be organized and
I had a folder
and control, and you do, and you are also an advocate vocally, right?
Yes.
What I find, of course, this affects Black people across all socioeconomic levels. And I also worked at Grady, as sometimes we could go to the sickle cell department and help in the emergency room for that group, and the asthma clinic as well. And you have people that just that struggle with health literacy, struggle with interacting, even though they've been in the system a very long time. And so they definitely need, everybody needs an advocate, particularly someone going back and forth. But I think, Tyreen, you said one time we interviewed that you knew that there were families where they just had to leave the child there, which especially for teenagers, before, like when they can talk and do things alone.
The parents would leave them there
because they have
to go to work. Yeah.
They have to go to work. This becomes a social determinant of health issue when people have to work. And I think Commissioner Miller and you both alluded to the fact that this becomes a financial struggle while you're trying to take care of your child. So medical record keeping, but having a vocal advocate. I can only imagine if you're taking medications, you're sick and in pain, particularly as you become a teenager, you need that person there. So I would still encourage anyone with sickle cell disease to continue to have that one person that can go to the hospital, write those things down, who is taking care of you, because the medical system has also become more complicated with different professional people coming in and out the room, and you don't know who's here, who's not. And then next thing you know, someone is on service that doesn't know anything about you, and next thing
and I would dismiss them.
Right, you would, right? My mama bear would, but other families that don't have that type of support. I think that one of the advocacy works, I hope that one of the grassroots organizations has almost like, an ability to start to do like what we do for women in labor, the doula program. I think someone like a sickle cell angel.
Well, I think now they have a patient care advocate in some hospitals, but I'm not sure if all hospitals have them.
Yeah, I think that this may be something, like I said, if there was any type of advocacy within the hospital system, that there should be some type of, I know you're talking about campaigning and campaigns, and also making more things, making our politicians more aware of what's needed. What's needed is that person inside of the hospital system that's going to be able to advocate specifically for the sickle cell patient and their family. What are your thoughts on that, Tyreen?
Yeah, well,
I agree. I mean, I know that that's something that's definitely needed. I know that in some hospitals they haven't incorporated them into their staffs, but again, I'm not sure if all hospitals and sickle cell centers have them, but it is definitely needed.
You have a message for the healthcare system. You have been fiercely doing grand rounds and pointing your finger at us. And telling us something. And I want to give you an opportunity as we get ready to close out, what it is that you want to tell from your experience with your lovely daughter. What is it that you want the healthcare community to know?
Is to continue. I would like for people to continue to be aware that it is changing, especially with this administration, and that we have to stand ground with still moving forward with racial disparities in care. We need to keep pushing forward with addressing and developing protocols for hospitals and clinics and the treatment for sickle cell awareness. We need to continue to raise awareness with clinical trials throughout the country to make sure that people know where there are clinical trials and that they can also be cured, whether they're a child or an adult. And also to continue to try to raise money and provide funding for institutions so that we can continue these treatments.
I want to see something. I want to say something that just brought to my attention. Blood donors, blood donor drives. I think is one also something that, and I'm seeing the American Red Cross has a sickle cell initiative since 2021. They're part of HBCUs to help gain more diverse blood donors. Donor drives. Tyreen, from your child had a stem cell transplant. I don't think that people understand the relationship to being involved with blood donor drives. Do you want to speak on that?
I mean, we always participated in blood donor drives. I know that they always generally have them, especially around this time of year, but it's very important to have minority people to donate blood because it's needed, especially for sickle cell patients, because there's so much mixed background. So we need different types of ethnic backgrounds to donate blood.
We need to donate blood. When I'm one for transfusions, during COVID, we were using transfusion centers for our transfusions for COVID cures, right, for the medication that initially came out before the vaccine. That was taking up beds from COVID, from sickle cell families and also families that needed cancer. We also saw funding being shifted from the ability to continue stem cell transplant research for sickle cell. All of this being shifted towards, of course, COVID research at our major institutions of health like the CDC and the NIH. And even now, we notice that there is a drop in federal dollars, particularly to our HBCUs and places that will advocate for sickle cell patients. So there needs to be a uplifting of what we can do to help families, to help physicians, to help researchers, so that on the other side of this, kind of reorganization of our healthcare, that sickle cell families and the sickle cell community is not forgotten.
Yeah, I do want to give a shout out to Red Cross and for the viewer that gave that comment. BDO has done several programs in partnership with the American Red Cross, talking about this very thing, about getting Black blood, getting people of color to donate blood, because again, particularly for those in sickle cell. And I do believe we have to check that, but the last time I did a show with them, they have you can designate where what patients your blood will go to. So there is a special time. I mean, and that's not all the time, but there's a special time where you during that sickle cell awareness period where you can say, I'd like for my blood to be used for sickle cell patients. I also say in these times, it's very important to be fully abreast, because unfortunately, there are a lot of rural hospitals, urgent care centers, things of that nature that are closing, emergency rooms that are closing because of cuts to funding. And so when you have a patient in metropolitan areas, like I live in Atlanta, Grady Hospital is known to have a very robust sickle cell center. But if you're not living in a metropolitan city, you can have some real challenges, particularly when there's a pain crisis.
I'm gonna add that it's not just the rural communities. Even in Chicago, we are facing access hospitals. We have critical access hospitals and we have safety net hospitals. And so we have our smaller volume hospitals that are nestled in certain communities on the west side, on the south side, that are really in trouble. And so you may find this in the New Jersey and the New York area, smaller hospitals that are called critical access hospitals. They feed into your larger, like Hackensack hospital systems. And those, once they close, then what happens is you end up with people going to the emergency room. And of course, the time is of the essence when you have a child in a pain crisis, getting them the care that they need so that they can get expeditiously up to the ICU, make sure they get fluids right away, knowing that they get treated right away so that hopefully this won't lead to a very bad outcome or tragedy. The most families, I will say, I want to say that most children are in hospitalized with infections and also strokes and kidney failure. And these are some of the major issues that can be life threatening to people, children, and adults with sickle cell. As early as 2 years of age, we should be screening for strokes in children with sickle cell, is what I read. And also, we have to make sure they stay on the immunization schedule.
Exactly.
This question about whether immunizations are good or bad for children of sickle cell that have sickle cell, this is a lifesaver. And so it's very scary, just like COVID became very scary for parents that had sickle cell children, or even the sickle cell trait, because sickle cell trait individuals can behave if they very much overwhelmed by disease or infection, like a full-blown sickle cell disease patient. Any questions that we need to go to, Ellis?
No, there was a question about links to resources. So I did put that in chat but I'm going to put it on screen here. This is from the sickle cell disease.org website, and they have a number of links for resources that you can tap into. You can also go to the American Red Cross to learn more about blood donations, and particularly for blood donations to people living with sickle cell. So I want to give American Red Cross their flowers as well. So.
And I know that also the National Donor Marrow Program, they also have a lot of blood resources in terms of finding donors and having blood drives as well.
Mm-hmm.
And there's a Super Bowl MVP. His name is escaping me, but we've had him on programming here before. We did some programs with him, and his son has sickle cell. He didn't know anything about sickle cell. He was 17 when he had him. And so he had no idea. And so he had to learn on the fly. And so he started leveraging Santonio Holmes.
Oh, yes. Okay.
Santonio Holmes is a big advocate. And so he's got a foundation that provides resources, funding, things of that nature. And he's lending his platform as a former NFL player and a former Super Bowl MVP to drive awareness.
I think our other star is, I think we have to give a shout out to T-Boz. I forgot the name of her book. She also lifted up her voice and her struggle with being TLC. And she wrote a wonderful book. And she had an interview in People magazine about her struggle as a performer. So you can do anything, you can live a full life. We want to make sure people have hope when they do have a child with sickle cell. But she lended her voice and her struggle with having a disease and being a full-time performer, to talk about dehydration, stamina, lack of sleep to perform, and so I'm a 70s, 80s, what have you.
Me too.
I know about TLC and T-Bob, So we want to thank her. Aflac is another a company that they have to call the Aflac Duck. They used Nas to create a nice video about their work in sickle cell and going to Children's Hospital, and they give them the Aflac Duck on the sickle cell floor on kids dealing with sickle cell. So I just wanted, there are companies, and we definitely need to keep a running list for the audience, and we'll continue to work on that, Ellis, for them. So I just want to make sure that this month did not go by without us having dedicated time to talk about sickle cell disease awareness, that we've got to make sure we continue to uplift our grassroots organizations that may be lacking funding. And then, of course, on the other side of this, making sure that our funding for sickle cell awareness does not go away and sickle cell research does not go away.
So a couple of things you can do as somebody that's not living with sickle cell. Number one, donate. We always need money for research. We need money to to support families. We need money to provide those notebooks, whatever they need. Money is always a great thing. If you don't have money, you can donate blood, right? So you can donate your blood as a person of color, and that is something American Red Cross and other organizations, you can donate your blood, because that's one thing that I had to learn on this journey about learning about people living with sickle cell. They have a lot of transfusions.
I know that we used to participate a lot in walks as well. They have several walks where they raise money for sickle cell.
And then advocate, right? So advocate in your healthcare center where you're going. Ask them, particularly with your pediatrician. Make sure if you have a child, that pediatrician, even if your child doesn't have it, just ask the question, hey, do you have any patients living with sickle cell?
Well, I advocated in the schools as well, because that's also another area where it's important, because sickle cell patients can get extra care, like a 504 plan. So I always want to make sure that the teachers and administration and the nurses that are working in the schools are also aware that patients and children could be attending their schools with this disease, and that they should be educated about it as well. So I advocate for that.
And finally, one more thing. If you're an adult that was born prior to 2006, because that's when mandatory testing happened. So if you were born prior to 2006 and you don't know your status, go get tested and find out what your status is, particularly if you are thinking about having children. You and your partner should get your status, not that it should deter you, but just understand that the risk that may be involved if you both are carriers of sickle cell trait. So
and have these conversations, have these talks.
Well, Tyreen, you can trust me. We gotta
look. I don't know how many times we've had those conversations, but you need to have them. At least know your status before you start to engage in a relationship.
All right. Thank you. Thank you so much. And
thank you for having me.
In addition to another big topic that we have tonight, it's a 2-for-1 evening, and we're on to our next topic. Ellis.
Tyreen, thank you so much. I put the link
for having me.
Book
thank you.
In the chat. So y'all please go buy the book. Those are the types of stories that helps give you the fuel for your advocacy. So thank you so much. And folks are really just giving you shout out and giving you flowers while you're still here. And good luck and much blessings to your daughter.
That's right.
Thank you so much. She needs it.
hopefully she'll choose hematology as
possibility
as a discipline, but primary care works just as well. So again, thank you all, and stick with us, because we've got another show right after this one at the top of the hour. We're going to be talking, because September is not just Sickle Cell Awareness Month, it is also Prostate Cancer Awareness Month, another disease that kind of gets overlooked, particularly because it impacts Black men in a very significant way. So we're going to be talking to some urologists and specialists at the top of the hour. So men that have been watching this one, stick with us for another hour.
And go get ready.
And we'll be here. Okay.
Thank you.
Thank you.
Bye-bye.
Bye-bye.